Yeah, my name is Robby, CEO for Puntukurnu Aboriginal Medical Service that provides primary health care for First Nation people in East Pilbara. Being remote just means to organize all the logistics that you need to make sure you've got everything you need to provide a comprehensive primary health care. Can be a challenge in terms of distance and can also be a challenge in terms of cost. So when you put all together, what you end up finding is that you are better off trying to work to attract services to come to you as opposed to move individual families to go to where the services are, even if they are tertiary clinical services. The ownership or feeling the sense of respect for First Nations people, that's very important. I'll give you an example. When we're building this, we spent 6 months just consulting. How do you want it to look like? Or even the clinics we've done in the desert. The goodness is that when they tell you what they want and you work according to that, then they take ownership. Then, no, this is our clinic. Even if there's a problem that comes later on, they'll be, no, but we told him what to do and he's just told. So that ownership is very, very, very important, especially where culture is very important in our cohort. But it has to be done with us, not on us. And I think for me, that was and the patients, they will tell you, I think 12 months, the doctor, he would come here, we agree to disagree, he comes 12 months. But for me, that was important to get that buy-in, from the community. And that's where we are today. Very, very, very important. I cannot overemphasize that, simply because if in my statistics I've got 100 people who might get lung cancer due to smoking or other environmental factors, in due course, due to services like this, cumulatively, if I can be able to save 50, 60, 70, 80% of that cohort, think about, all the benefits, to the communities, to the families, first of all, at a family unit level. Because what we forget is that any one of these elders we are losing to premature death is leaving young children who remain without any cultural guidance. And then these are somehow the future leaders of tomorrow, community members of tomorrow, who are left in the lurch without any cultural guidance. Where do they end up? So for me, it's an ecosystem, and one of the things we need to do better as well, let's help and sustain the body, but let's treat the mind as well. Remember, the mind, it's like an engine. So I think we become so somatic in our approach that as long as I'm feeling good. No. Society is how, their well-being, mental. And so all those programs, when you put them together, you create better health outcomes for the people.